Good morning, everyone. Thank you for joining us today. Welcome to the BHS COVID-19 Best Practices webinar. My name is Tim Coster. I'm a partner with BHS on the commercial insurance side of our practice. We hope you and your families and all of your coworkers are staying healthy and safe during these unprecedented times. It's a privilege to have you all join us this morning, and we hope the information we share with you today is helpful in navigating today's business world. A little positive for those of us who call the state of Michigan home. Hasn't snowed yet today. Hopefully we see some sunshine soon and we have some warmer days ahead. We've had an overwhelming response to today's webinar with over 300 individuals registered. We asked you to submit questions in advance so we can be sure the information we're delivering is valuable and on point for you. We've received over 100 questions that we've used to develop today's presentation, so you did not disappoint. That said, we're going to easily fill the 60 minutes we have scheduled with you today in an attempt to respond to these questions we've received. Please do not let that deter you from submitting questions that may come up during the presentation today. If we don't have time to respond to your questions while we are live this morning, please know we will respond following the webinar, and we will send those responses to all participants so we can all benefit. We do have all attendees on mute to limit background noise. So I'm going to assume that you're all smiling and laughing at my jokes, and as this video goes viral this afternoon, I'll likely get a Grammy invitation to be a lead presenter. Please submit any questions that you have throughout the webinar today through the chat function on the right-hand side, or you can always feel free to reach out to us at askbhs@bhsins.com. Lastly, before I introduce our wonderful team of presenters today, please know the webinar is being recorded, and we'll distribute a link to you along with a copy of the PowerPoint that we're going to walk through today, so you can share that information with others who couldn't make it this morning, or you can refer back to the PowerPoint as needed. We have included a lot of details on this PowerPoint because we assumed you'd likely want to refer back to it. So hopefully you find that helpful. We have three wonderful team members of mine at BHS who are going to lead our discussion this morning. To start off, we'll hear from Denise Neuhaus, who's our Director of Human Resources at BHS. We like to think we're professionals when it comes to insurance and risk management. We're by no means professionals when it comes to running webinars for over 300 attendees. We've already had our first technical difficulty of the day, and Denise's webcam wasn't working. So we won't be able to see Denise. We've got a beautiful picture of her up on the PowerPoint right now, but we will be able to hear her. Denise has over 25 years of experience in the world of human resources. She's been with BHS for 15 years. Denise is an amazing resource for our clients on a daily basis, and that has been magnified over the past 5 to 6 weeks, helping us all understand the implications and new regulations and laws that we're dealing with. Denise will handle a majority of the presentation today, as the HR-related questions we received were vast. Following Denise, we'll also hear from Rich DeLeau and Chris Scholten, who are in our risk management department at BHS, and they're going to touch on some personal protective equipment topics for your employees as you look to bring those folks back to work, hopefully very soon. Rich serves as our Director of Risk Management at BHS. Rich has over 30 years of experience in the world of safety and risk management. He's been with BHS 4 or 5 years. Vast wealth of knowledge when it comes to occupational health and safety. Rich is a tremendous asset to BHS and our clients. Chris also serves as a risk management consultant at BHS. Chris has 15 years of experience in safety and risk management, and he's been with BHS for just over a year and a half. Chris is committed to helping our clients improve their safety culture on a daily basis. He often participates with our clients in internal safety committee meetings. We've got a tremendous team for you this morning, a ton of experience, great expertise. If we let these three loose, we'd likely all be sitting in front of our computers for several hours. because they could talk on these topics all day. But we promise to stick to our schedule of 60 minutes with you this morning. And if you hear me jump in to keep us on schedule, you know why. Thanks again for joining us this morning. We hope you find this valuable. I'm going to turn things over to Denise, who's going to start with our first HR topic for today. So Denise, there you go.
Good morning. I was laughing at your jokes, Tim. So maybe Tim should leave his face on, and you can look at him while I present instead of no face. As Tim said, thank you for joining us. We're happy to help, and we hope that the information that we've provided answers your questions. If you see questions that we don't get to or didn't answer, please feel free to send those questions in, and we'll answer those when we can. Just wanted to say most of the advice that we're going to give this morning will be based on Department of Labor, CDC, IRS, so federal guidance. And then when we talk about state guidance, we will be referring to Michigan law. So if you work in another state, you have employees in other states, some of that may not apply. And then if you have any questions related to that, feel free to let us know. And I cannot advance the slide, so maybe Tim, you'll have to do that. Okay, so first thing I want to talk about is if you have sick employees. There were several questions about that. The CDC gave guidance. If you have employees that appear to have symptoms when they arrive to work, the first thing that you want to do, of course, is pull them away from the rest of your team, send them home, ask them to call their physician to see if they are eligible for a test or if they can get a test, and they will need to quarantine if their physician recommends that. If you have an employee that's confirmed to have the virus, employers should inform fellow employees. There's a letter template that we've shared with a few of you. We can share that with more if you have any questions on that, to let your rest of your employees know that they've been exposed and would need to start watching for symptoms as well. Remember that the Americans with Disabilities Act does not allow you to say who has the virus. Of course, sometimes we'll figure out because of someone that's absent, but in your written communications, you should not identify the employee that has the virus. Next slide. After exposure, so one of the questions that we've had quite a bit was, how do we know who to send home? I have had questions like, I have an employee that is living with someone that has been diagnosed with COVID-19. They're staying home on a quarantine. Do I now need to quarantine everyone in our workforce because they have been exposed to that person? And at this point, the answer is no. The reason for that is you want to focus on exposure to people who have a diagnosis of the virus. So when we talk about close contact, there's quite a few factors involved in that, and the CDC tried to give guidance, but it's been difficult to really kind of make that really clear, because if you have close contact with somebody who's coughing, you're going to have a more likelihood of getting the virus than if you have close contact with someone who's not. Also, if you have close contact with someone who's wearing a mask, your likelihood of getting the virus is lower as well. So close contact is described as less than 6 feet for a prolonged period of time. The prolonged period of time tends to be listed as anywhere between 10 minutes and 30 minutes. So that one is a little unclear too, and it really has to do with all those factors. We had questions about when we have an employee say that they've been infected, what do we do about doctor's notes? Can we ask for those? Can we require those? You can certainly ask for them. Requiring them is another difficulty because a lot of our physicians are saying don't come to our office, call. Some of them are still giving notes, but you may have an employee that is unable to get a physician's note to stay out of work and also a physician's note to return to work. If you have an exposed employee, certainly refer them to the CDC public health recommendations for community exposure. There is a link to the website there. Gives a lot of great tips about how to take care of themselves, how to take care of their homes, how to clean and disinfect. And I think that's a great way to help keep your employees safe and the rest of their family members safe as well. Next slide, thanks. So now we're going to talk about the Families First Coronavirus Response Act. There are paid leave requirements in that, and we're going to focus on that. And again, this is a federal requirement. I listed all the qualifying reasons for leave. I'm not going to go over those in great detail. Like Tim said, we wanted to give a lot of detail on the slides in case you needed to refer back to those. An employee could qualify for paid sick time if they're unable to work, including unable to telework. So if you have employees that are working remotely and they've been exposed but not sick and are at home on a quarantine but can still work, that's okay for them to continue working, and you should encourage them to do so. If you have an employee that's working remotely and is sick and unable to work, then that's different. They would qualify for the pay at that point. Number one on the list has created a lot of confusion because this is a federal act, and the federal kind of ties back to the CDC's definition of quarantine or isolation, and the Michigan stay-at-home order doesn't seem to go in line with that. So number one is most likely not applicable. However, as Governor Whitmer phases back in people to come to work, we're hearing there's a possibility that some of the more high-risk individuals might be stay on quarantine. So could it come into play at that point? Possibly. So the other thing with the paid sick leave is I've gotten a lot of questions. My employee is nervous about getting the virus and wants to stay home. Would I pay the employee the 2-week sick leave? So as you can see, on all of these definitions here, it's related to either being advised by a healthcare provider to self-quarantine or having symptoms, or even caring for an individual that's been advised by a healthcare provider to self-quarantine or care for someone with symptoms. So we want to put our focus on that when we're looking at this 2-week paid sick leave. The FFCRA also has the provision in number 5 for caring for a child whose school or place of care is closed, or if their child care place is unavailable due to COVID-19 reasons. Next slide.
I think we might have lost Denise here a second. Bear with us for one moment.
Can you hear me?
Yep, we can hear you again, Denise.
Okay. So I'm having a little trouble with my internet connection for some reason. It's very frustrating when you're trying to present. I'm ready for the next slide. I don't know where you lost me.
We're looking at the calculation of pay slide, Denise. Is that the correct slide you need to be on?
Yes, except I can't see it.
Okay, we're looking at it.
Okay, sounds good. All right, I probably need to pull it up for myself so I can follow along. I'll do it on my tablet or something here. So when we're calculating the pay, it's really for the, sorry. So for the employee's purposes, if the employee is sick, the employee is under quarantine, and so on, they would be eligible for the 2 weeks of pay. I'm really sorry about the technology difficulties. Very frustrating.
All right, we're gonna close out of the PowerPoint, reopen it, and see if that helps fix our difficulties here. I am going to unmute a participant to see if we can get some feedback as to what others are seeing. All right, any response? You guys can send us messages via the chat function. Is everybody looking at the calculation of pay slide?
Right now I'm seeing qualifying reasons for leave.
Huh. Okay.
Something froze up there. So I'll just maybe keep talking a little bit. After qualifying reasons for leave, we were talking about the duration of leave. So the duration of leave for the employee purposes, if you're looking at the qualifying reasons for leave screen, so it's reasons 1 through 4 and 6, is 2 weeks. And that is really just a one-time 2-week period. It wouldn't be, I went on self-quarantine, I didn't get sick, I came back, I got exposed again, I went back on self-quarantine. It's just for 1 2-week period. Eligible for up to 80 hours of leave. A part-time employee is eligible for the number of hours of leave they work on an average over a 2-week period. So you can look at a previous look back to figure out that if you have variable hour employees, or you can do that pay based on what they're normally scheduled. And then for number 5, for caring for a child whose school or place of care is closed or child care is unavailable, this is an Emergency Family Medical and Leave Act. And so that gives the employee up to 12 weeks of leave at 40 hours a week. Part-time, again, is prorated. So if you already understand how to calculate FMLA, you would lean on those same rules. If you have any questions on how to determine hours, please feel free to let us know. We can handle specific questions. So calculation of pay for 1, 2, or 3 employees taking leave should be paid at either their regular rate or the applicable minimum wage, whichever is higher, up to $511 per day and up to $5,110 over the 2-week period. Remembering that part-time would be prorated in hours, but get the 2 weeks at their regular rate of pay. For 4 or 6, caring for someone else, so taking care of another individual or experiencing symptoms, substantially similar symptoms, the employee would receive 2/3 of their regular rate or 2/3 the applicable minimum wage rate, whichever is higher, up to $200 per day, and up to $2,000 over the 2-week period. For the family medical leave, again, it's the 2/3 of their regular pay, up to $200 per day. And the first 2 weeks of that is considered unpaid. However, the employee would qualify for the emergency sick leave. So for the first 2 weeks, if you have a full-time employee, that employee would receive the full 2 weeks in that first 2 weeks under the emergency sick leave. And then once that expires, the next 10 weeks would be at the 2/3 pay, up to $200 per day maximum.
Hey Denise,
So the
we have shut down the PowerPoint and I brought it up as a PDF and I've gotten confirmation that the participants are seeing this. What slide
Okay.
would you like me to take us to?
I would like to be on the tax credit slides at this point. It's one up from where you're at.
Okay, good to go. Thank you.
All right, thank you. We can adapt, right? And that's is so indicative of the times, right? We have to adapt to everything that's happening. So we can do this on a presentation too. Thanks, Tim. So tax credits, employers are eligible for dollar for dollar reimbursement through tax credits, including the amounts that you're paying for health insurance coverage. I know that that's an important one because many have opted to continue health insurance even if employees are not working right now, and that is a big expense. Of course, health insurance needs to be treated the same as any other Family Medical Leave Act provision, and that allows for the continuation of benefits as if the employee were working. You can go to the next slide, Tim. I just wanted to talk about a couple things specific to the emergency family medical leave for childcare, remembering this is for childcare only. So I've had some employers that are not typically subject to the Family Medical Leave Act, which normal times that you have to have 50 or more employees. In this pandemic, this particular act is available for any employer that has 500 or fewer employees. So you can see that covers a lot more of us than the act would normally cover. So if you need to offer this childcare, you've got to kind of catch up a little bit on the FMLA requirements as far as tracking and benefits and different things. And if you have specific questions on a leave, we're always happy to help. I've had a lot of questions about this one. We've had our employees on layoff, or we've had a shutdown, whatever, furlough, whatever you're calling it. We're calling people back, or we're anticipating calling people back, and we know that we have some people home with their children. Would they be eligible for the Emergency Family Medical Leave Act? And the answer is most likely. As you can see in bullet point number 2, they would generally not be eligible if telework is available. So if your employees can work remotely and you've given them flexibility to do that, the emergency family medical leave is not generally available. However, we do have some employers that are offering it on an intermittent basis if you choose, for employees that need to be available on a pretty set schedule. So if they need to stop and help their kids with their school for a little bit and then come back to work, you can allow them to use the FMLA on an intermittent basis. To receive the tax credit, we have to have documentation, and you want to have the employee have some kind of request for that leave, whether it's on a formal form, and the current FMLA forms do not cover that. So, you know, a general leave of absence form would be fine. We can share a couple templates there too, or just a verbal request is a start. And we always have said, you know, with an FMLA request, the employee just has to say that they need time off for a qualifying reason. So I would recommend getting it writing in case you need that documentation. You need to have the name of the child, the name of the school, place of care, child care that's closed or not available, and also a statement that no other suitable person is available to care for the employee's child. So if you have, you know, mom and dad are both home and dad's not working and mom is supposed to return to work, at that point, mom would not be eligible for emergency FMLA because dad is there taking care of the kids, or vice versa. Next slide. There's a poster requirement, and I've had a lot of questions on this. How do we put a poster up when we're not there Do we have to put a poster up? Do we have to mail this to our employees that are on layoff? So the Department of Labor did a Q&A page on this, which is on the next slide, talking about the posting. And since most of our employees, a lot of us have employees that are teleworking, where do I post this notice? And so we don't have to mail these out to people that are on layoff, or if we're on a company shutdown, because the emergency paid leave does not apply in those circumstances. However, if you have people that are working but are not in your building, you can post it on an intranet. You could put it out through email, on your website if people are accessing that, on your HR system if you have people that need to go to that regularly. And so electronic is probably your best way to get that out there. So next we want to talk about employee benefits and a couple different provisions related to those benefits while we have people out. So the emergency sick leave provisions under the FFCRA, benefits should be continued if they qualify for the child care provision as if the employee is working in the same terms as, I put quote unquote, regular FMLA. On the emergency paid sick leave, we've had a lot of questions. Can I cancel the coverage? The answer to that is no, and you can see there's a long answer related to HIPAA on why that is, and what that basically says is you can't change the terms and conditions of your plan. You have to consider that people are on sick leave are kind of actively at work the way you would, especially when they're receiving paid time off. So we don't want to cancel the benefits the second that somebody goes out of work. In addition, on the next slide, we have people on layoff, leave, or furlough. The employer may choose to continue the benefits. The insurance carriers came out really quickly and offered this as an opportunity. It certainly helps keep our employees active with us, connected to us, because we continue to offer that benefit. It keeps them safe should they get sick. And certainly, if you have the funds to be able to do this, you have the option to do so. The employer does still need to continue to pay the bill, so it would be very difficult if you wanted to try to collect the full premium from the employee. There are a lot of issues related to that. If they don't pay, what happens, and how do you collect that later, and what happens with COBRA? So best practice and what the insurance carrier said is you can do this as long as you continue, the employer continues to pay the premium. You can ask the employee to continue their contribution. And I know we have employers doing all kinds of different things for that, asking them to pay it before they go out. I know when we first anticipated that maybe we would only be out for a few weeks, employers were collecting 1 month's worth. You can have people catch up on those premiums when they get back to work, or you can certainly forgive those if you want to pay those in full because you're not sure people can reimburse you. On our paid time off policies, we want to make sure to remind you not to forget about the Michigan Paid Sick Leave Act, Paid Medical Leave Act, I guess it's called, sorry, PMLA. This is for employers with 50 or more employees. The FFCRA does not replace this. So if you have an employee that takes time off and is sick, maybe they use the 2 weeks from the FFCRA and are unable to return, the paid sick leave would kick in at that point if they still have time available. I know a lot of us tied it to our PTO programs, and so they may have already used their time for vacation or other purposes. So if they have time available, you need to allow the employee to take that time as well. We've had a lot of questions about paid time off. Can the employees take their paid time off? And the answer is it's based on your company policy. So if you normally allow people to take paid time off while they're on a layoff, for example, you would follow that policy. I have had a few of our groups ask, can I discontinue benefits for the time being? You do have the ability to change your benefits. Best practice is to do that by giving notice. And I don't know if this would be the right time to completely take away a benefit, but you would have to evaluate. And I think the best practice on that one is to probably talk to some kind of legal counsel to make sure you're doing that correctly. Next, we want to talk about unemployment, and this will be specific to Michigan. A few people asked, could I just give a brief overview of how unemployment works in Michigan? And Michigan is a quarterly, it's a wage system, meaning that they use quarterly wages to determine the employee's benefits. That can put their wages back quite some time when they're looking at that eligibility. As you can see, if I apply in April of 2020, I'm actually looking at wages from January 1st to December 31st in the reporting of the wages. The reason for that is the quarter that we're in now hasn't been reported. The previous quarter is considered a lag quarter, and unemployment looks at the previous 4 quarters prior to that. They come up with the highest quarter, do their math. I'm giving a real general overview because we could almost do a whole presentation on unemployment. But that is why when you see those determinations and you've had an employee that hasn't worked for you for a while and you see yourself listed as part of the chargeable employer, that is why, because it looks back at wages. And you could have an employee that already has an open claim or had an open claim with you, goes and works somewhere else, is ineligible because they're working, and now is laid off, and that claim could pick back up if they had open credit weeks. So unemployment can be really confusing. I get that, and their website is a little bit difficult to maneuver sometimes. I will say, if you don't have a MyWAM account already, that's MIWAM. If you don't already have one, this will be a great time to register because you're going to get the best and quickest response if you use the website. On the next slide, we're looking at our governor has made several executive orders related to unemployment. The most recent was Wednesday, and that was due to the fact that the previous order had expired. And at that point, really kind of extended that one. I think I might have put, sorry, I put it on the next slide. I'll wait. So we're looking at eligibility reasons for unemployment. It really ties back to involuntary medical reasons again. So you can see these are 2 of the reasons that are listed. Leave of absence because of self-isolation or self-quarantine due to elevated risk is one of those as well. So if you have an employee that's immunocompromised and they self-isolate, they could qualify for the benefit as well. On the next slide, you look at an individual who becomes unemployed and files a claim, can do so within 28 days instead of the original 14. The order extended eligibility beyond 20 weeks to 26 weeks. And for employers, put these charges to the non-chargeable account. So the nice thing is this hopefully won't impact your taxes significantly. Now, if you as the employer misclassify an employee, so I quit and you list me as layoff and that gets discovered, those charges would be assessed to your account. So you want to be careful not misclassifying your employees. So the order 2020-57 was the one that was added on Wednesday, and it remains in effect until the declared state of emergency and disaster is over. So hopefully she doesn't have to keep re-releasing this order. We were all holding our breath every time the expiration date came to see if those charges were going to start being assessed to our unemployment accounts, knowing that that could raise our experience level and also impact our taxes for following years. In addition to the Michigan, we have the federal unemployment coming from the CARES Act. And this gives an expansion of unemployment benefits. So you can see an additional 13 weeks. So because we have 26 weeks in Michigan, this could add an additional 13, giving an employee 39 total weeks. The enhanced benefit will provide an additional $600 per week on top of what the employment program pays, and that's through July 31st at this point. In addition to employees that qualify from the state level that were working, this provision gives many individuals who are typically not qualified for unemployment will qualify for employment under this package. So independent contractors, gig workers, self-employed, and even employees that maybe were underemployed. So maybe just started working and doesn't have enough credit weeks. So if you have employees that have questions about that, I would refer them to file under this. There's a tutorial on the Michigan unemployment website they can take a look at. Next slide. For the CARES Act, if the employee receives even $1 of the state unemployment insurance, they would be eligible for the full $600 per week of the CARES Act benefit. That was surprising to a lot of us, and you can see that that could give quite a bit of money. So if you have employees that are working reduced schedules, this chart below kind of tells how unemployment calculates that. They can receive a partial benefit still. So if you have people working reduced hours and are concerned about that, you can certainly refer them to unemployment. They can apply, unemployment will apply their formula to that. And if they receive that, they would potentially receive the additional $600 as well. Next slide. If you have an employee that declines work, all of the guidance has been relatively employer friendly on this. So if you offer work to an individual and that individual says, I do not want to come back to work, or I'm refusing to come to work, they are not supposed to be eligible for unemployment. However, like in 2008, when the unemployment insurance agency was overwhelmed, people were getting unemployment that weren't eligible. You're probably going to say the same thing now. So it will be your responsibility as the employer to dispute those charges when you see those charges come through. And the phrase I've been telling people to use is refusal of suitable work. So if the employee quits, you also need to note that the employee quit. So if you leave on an involuntary basis, you're generally not eligible as well. There's just a couple of exceptions. If the employee feels like they're in imminent danger and they report that to the unemployment insurance agency, they will most likely qualify. So if they go in and say, my employer isn't cleaning, they're not offering social distancing opportunities, there's too many people in the building, whatever that is, they could potentially qualify as well if those guidelines are not followed. Then the Department of Labor issued guidance because they're overseeing the FFCRA. So they actually had some specific questions, and I did provide a resource link to this later in the presentation. A couple of the questions, my employer has remained open because it is essential. I'm not sick, nor is anyone in my household sick. I do not have child care for someone who cannot, I do not have children or care for someone who cannot care for themselves. So all of those reasons. However, I'm afraid of getting the coronavirus. And the Department of Labor said, no, you would not be eligible for unemployment. In the second example, my employer will let me work from home with pay. However, because my children are out of school and my spouse is working, I need to care for them. And it's too difficult to work from home. And in this example, the Department of Labor said, yes, the employee would most likely be eligible. So I would say on this one, if you have employees that are working from home and you have the ability to give them flexibility on when they work, especially if they have a spouse that's working outside of the home and they can kind of trade off, offer that flexibility if you can. And then when we start talking about returning to work, the first question is, what is Governor Whitmer going to do? So I made a little acronym there. She did talk a little bit about this in one of her presentations or delivery, what are those called? Sorry, lost my words there. Talked about controlling access, physical distancing, improved sanitation and hygiene, protective equipment, testing, isolating. And so she kind of put a slide up that had some different things that are being considered. Temperature checks is one of them that was listed, limits on visitors. minimizing the number of employees that need to be in your office or place of business, closing common areas and limiting meetings, really specific standards potentially about cleaning and disinfecting. The cloth masks for workers came up, which we're going to talk about a little bit more. And then, she just said there are a lot of factors to consider, and a lot of it's going to depend on what your business is, how your building looks, can you reconfigure to put people further apart. But as you can see through that, there are some provisions that we may need to prepare for. So I also put this slide in 10 steps. This is from OSHA, that all workplaces can take to reduce the risk of exposure to the coronavirus. And I think that's really useful information as well. Next slide. When we look at discontinuing home isolation, we know we're going to have employees that are afraid, and we're going to have to manage that. So there is some guidance for discontinuing home isolation from the CDC, and you can see it on this slide. If you will not have a test, if you are to determine if you're still contagious, you can leave home after these 3 things have happened. You've had no fever for at least 72 hours without taking any fever medication. Other symptoms have improved. So your cough or shortness of breath have gone away, and at least 7 days have passed since your symptoms first appeared. On the next slide, you'll see if you have had a test, or if you're going to have a test to determine if you're still contagious, you can leave home after these 3 things have happened. You no longer have a fever, other symptoms have improved, and you've received 2 negative tests in a row 24 hours apart. And so the doctor will provide or follow the CDC guidelines. However, there was a disclaimer that says in all cases, please follow your healthcare provider and local health department's recommendations. So if your physician says something other than the 72 hours, the employee should follow that direction, and the employer should allow them to. So how do we manage that fear? I think what's most important is communication, encouraging people that it's safe to come to work. Describe to them what steps you're taking to protect their employees. Provide clear communication on expectations and procedures. What are employees supposed to do to participate in that safety? Stay connected now. Be sure that you're communicating with your employees, letting them know that you're looking forward to coming back to work. That personal touch can make it a little bit less shocking for them to come back because you've had that continued connection. I included a link on the next slide with some myth busters I thought were interesting. There's a lot of misinformation out there about the virus, how you can get it, and what can keep you from getting it. I think these are interesting to share. Some of them are funny if you can find humor in it. One was, if I drink alcohol, am I going to avoid the virus? So I thought that was interesting because it said something like, it's probably not safe to drink that much alcohol. So testimonials from peers that have remained working, I think would be helpful. Having people hear from their coworkers that, yeah, we've been working, we haven't had any issues. I feel safe. The employer is taking all the steps that they've told you they're going to take. And that can be comforting as well. So you can also look at some monetary incentives. If you have employees that you have offered pay to, for example, and they are at home, they may not be as motivated to come back because they've still got their pay and benefits. So if an employee refuses work, you may continue to allow them a personal leave, but maybe at that point, you change how the compensation looks. Maybe a lower percentage of their regular pay, or if your policy doesn't allow for benefits on personal leave, maybe you just continue benefits. There are some strategies that you can use. Now, I know a lot of us have the PPP, Paycheck Protection loans in place, and we're not supposed to lay off team members, and we need to use a certain percentage of that money toward wages and coverage of healthcare. So one of the strategies you could do is give employees working a little bit extra and a bonus and take away some from employees working from home. That's just I'm throwing that out there. Of course, any of these solutions, you may want to have a consult with someone, with an attorney or the person that is handling your PPP loan. And then we already talked about the disqualification for insurance. So that is going to segue into talking about personal protection. And Rich and Chris are going to talk about masks and gloves and temperature, and I will turn it over to them to take over.
Okay, hey everybody, good morning. And despite the technical difficulties that we just experienced a little earlier, the show must go on, as they say, and Denise, you did a real nice job in quickly adapting to the situation. My name is Rich DeLeau with Risk Management Services, and I'm going to talk about masks, as Denise had mentioned, specifically to start off with, the N95 Respirator Mask is the essential protective equipment used by healthcare professionals fighting the virus pandemic. It's reached a critical low since the onset, and it continues today. So I'm going to talk about non-medical masks, sometimes referred to as the homemade mask or the do-it-yourself DIY face covering for the general public. Manufacturers have gone on the bandwagon, and they're also making those too. So you'll see different versions of them if you were to look them up on the internet or something like this. So until more medical masks become available, homemade masks are worth using outside of the healthcare settings. CDC's reason for recommending homemade masks is to reserve the limited supplies, the medical face masks, for healthcare workers, since they're supposed to dispose of them after one use, and even they are disinfecting them so they can keep reusing them. So some of you have to resort, and some of them have even resorted to using bin bags, snorkels, office supplies, and those types of things that's found in your craft stores. Over the course of the few weeks that we've gone through, non-medical mask coverings have gone through the grassroots campaign for personal use and patients in medical centers to the voluntary health recommendations by the CDC. And there are some mandatory orders in public places. A growing number of states have joined in, and so have counties. As of yet, Michigan has not, but that doesn't mean that it won't go there. For example, if we start going back to work, Governor Whitmer might have it in their next executive order that we've got to start wearing these things. So here we go. Non-medical masks are not the ideal solution. I get that, and so do you, but their advantages is that they are relatively easy to make or to buy. Next slide. Or wait a minute, we can stay at that slide. So on April 3rd, the CDC came out with the guidance on the cloth mask, and you're seeing that on this slide right here. There's also data that some benefits of wearing homemade masks in crowded places like supermarkets and pharmacies and those type of things versus no mask covering at all is better than nothing, as they say. However, I do want to mention that social distancing and hand washing are still paramount. So don't get into the comfortable position of thinking, hey, I've got this homemade mask and I'm good to go. That's just part of it. The cloth mask is much less protective than surgical masks and N95s, but as I mentioned, they're better than nothing, and research has been able to back this up. In fact, in a 2008 study conducted on homemade mask protection of surgical masks, they would still hold back tiny aerosol droplets. And so with that in mind, it will reduce the transmissibility of variable particles, even though it might be smaller amounts getting through the mask than what an N95 might be. It may still be significant amount in such that it may make a difference. So wearing the mask is actually twofold. It can give some degree of barrier protection for respiratory droplets when somebody coughs or sneezes. In fact, even when somebody breathes, there is some moisture, and some of that moisture could contain some of that virus. And studies have shown that the virus, even though it's very fragile outside of the host, it could live up to an hour to 3 hours in the air. So the infected person could be out of the area. You walk through there and you could be infected. And that's why the social distance is so important. And then the other part of it is people may be asymptomatic. You could be asymptomatic, you don't know. And so by the fact that you're wearing that cover out in public prevents others from catching the virus. And so the most important thing to do is when you do cover yourself is the mask, the homemade mask has to be able to cover the chin and of course your routes of inhalation, which would be your nose and your mouth. Keep in mind that your eyes are still exposed unless you're wearing goggles or you're wearing a half or a full face mask or a shield or something like this. But if you're just wearing the mask, you still have that other route of entry through your eyes. And so again, that's why social distance is so critical here. And then it's better to adjust your mask prior to going to the store or to a pharmacy or wherever you got to get to. Do all that adjustment in your car. And I do want to add to, and I have it in my own car, have disinfecting wipes along with hand sanitation. A lot of the studies have shown that even though people are wearing the mask, you have to realize that the outside of the mask is contaminated. And then people will go ahead and take their mask off with their hands, and all of a sudden now you've got it on your fingers, and now you're touching your steering wheel and all this other good stuff. And the fact of the matter is, studies have shown that that virus can last on a surface anywhere from 2 to 3 days, depending on what the surface material is. Going to the next slide. The homemade mask and coverings can be made from cloth fabric. Now, the CDC mentions 100% cotton. Other providers that are makers of this mask might be 100% polyester. It might be a blend. It might be made out of silk. It might even be made out of bed linen, whatever the case may be. But the guidance of the CDC is such that they're saying 100% cotton, double folded. And that's a good guidance, but keep in mind that you don't have to have that. That's just the guidance. If a manufacturer is coming out with something that is comparable or equivalent to what the CDC suggests, that would be sufficient. And as far as machine washing goes, all you got to do is put that in your wash cycle under hot, and then once it comes out of the dryer, it's good to go. Now, the other question that people are asking is, how many times can I wash this thing? All right, the manufacturer, if you're not making it yourself, the manufacturer might say 10 times, 10 cycles. Another one might say 15. It just all depends. There are too many variables, too many factors. A lot has to do with the type of material it is. It has to do with, is it double layered, triple layered, or is it tightly woven? Is it 400 count versus 600, 800, or 1200 count? And that's another thing I want to mention too. When you start making your own mask, if that's what you want to do and you're allowed to doing that, you can use different materials. And the more protection you get from filtration, it tends to be more difficult to breathe. So it's a balancing act. It's in terms of how much can I breathe or can I pass through, right, and still get filtration. So for example, a construction worker, they're doing heavy task labor. If you give them a mask that's, has high filtration value, it may be difficult to breathe when they're doing a lot of exertion. So it's going to be a touch and go. It's going to be a trial and error kind of thing. And so if you're going to go through a manufacturer that makes these, you might want to see what some of the specifications are on that mask. And then the last slide here for the CDC, it shows you the typical instructions on how to make that mask. It'll say things like you need a sewing machine, you need some thread, you need some elastic bands, and you need thread and that type of thing, and scissors. Now, I'm not a sewer. I can't do that, so I'm not going to make it myself. I'll go ahead and try to buy one, okay? And for those that can sew, and I know there are some places out there, nonprofit organizations that are making these things and giving them out to the public as a donation. So they're out there, and again, it's better than nothing. And the last slide I want to talk about here is taking temperatures. And here you'll see several bullet points. The thing I just want to stress on this is there are really two types of temperature guns, if you will. One is industrial and the other one is for human temperature taking. Make sure you purchase the one that's for human temperature taking. You can go ahead and buy the other one. It may not give you what you're looking for, and then you're getting erroneous readings. And so, and you're going to pay quite a pretty penny for it. Those industrial guns will cost anywhere from $300, $400. I've seen them go for as high as $1,500 or more. Whereas the temperature taking for humans could be as low as $50 and up to $125 or so. The thing that you want to look for is the spot to distance ratio. So most of these guns will ask you to have it at the forehead between 2 to 6 inches. So that's not a lot of social space distance between that person that you're taking the temperature and yourself. So, but if you add your arm's length and the pistol grip itself, the barrel, it might add another, couple of feet. So you might be as far away as 2.5 feet, but you're still within the less than 6 foot social distance. So keep that in mind. People need to be trained. I would go ahead and just have certain people that are trained on how to use this and go ahead and have them do it and set up some of those parameters. And with that, I know we're running at the top of the hour, and I want to make sure that we have Chris some time. And so the next subject here is gloves. So that's it for me for now. As Tim said, he will give you a copy of this PowerPoint presentation. And Chris, go ahead and take over. Thank you so much.
Good deal, everybody. Good morning. Just a quick note before I get going, we're almost done here. I've been the one taking all the questions on here. So I tried to get a private message back to each of you, but I've logged each question you've put in. We've had 23 questions so far, so they're logged and we'll get responses back to you guys. In terms of gloves, though, gloves are another tool that we have in the toolbox, so to speak, to fight against the spread of exposure. So just a couple things about the gloves. Hands should be washed before the gloves are put on and after they're taken off. Gloves protect against cross-contamination. What a lot of people fail to realize is these gloves should be used for a single-use task only. So, for example, I have seen people go to the grocery store, grocery shop, go back to their car, get in their car, drive away. Rich mentioned earlier that that's how you have cross-contamination. So if you are going to use a glove, it's got to be single use for one task only. You change the gloves when they're soiled or damaged, or you're finished with the tasks, and then the gloves should be thrown away if there's an interruption in your task. So if you're doing something and you get sidetracked and go do something else, you need to take that glove off, wash your hands again, get a new set of gloves, put them on, and start the process all over again. All right, next slide, please. All right, and then just how to take a pair of gloves off. So you can see the picture there. First up, you want to pinch and hold the outside of the glove. You're holding the outside so that you're not contaminating your skin. So you're pulling down on the outside of that glove. You're, in essence, turning that glove inside out. Step 3, you pull that glove all the way off, remove it from the hand, holding the inside of that glove on your other hand that still has the glove on. Step 4, with your ungloved hand, you slide your fingers inside the wrist. So because that one hand had the glove on, it's not contaminated. So you want to make sure not to touch the outside of the glove. You touch the inside of the glove. So slide your fingers inside between the glove and your wrist, peel down and pull that off your hand. At this point, you're only touching the inside of the glove, so you don't have any cross-contamination. Discard the glove. And as a side note, this is exactly what you do for any bloodborne pathogen from your universal precautions. All right, one of the other questions we've had a lot about is a business plan, the COVID response plan, action plans, call it whatever you want to. We do have multiple templates, different plans that are available that we can give out to you guys. For different industries, just a general one. We've got some for construction, some for manufacturing. Just as an example, what they could possibly include, this is not all encompassing, but a couple of the topics: the responsibilities in the plan, social distancing, what to do with visitors, what PPE is required, cleaning and disinfecting procedures, exposure situations, self-quarantining, and return to work. For construction, we've got job site protective measures and just some general safety. So just as a little quick legal disclaimer there, that these are just sample policies. They're not exhaustive to your business. It's a good guide, a good framework to build off of, but you need to modify it to your individual plan. And just take into account all relevant federal, state, and local compliance requirements into the account. So if you do have a desire to have a template sent to you, just please let us know. So you've got that email address, and I will turn it over to Tim then. Thank you.
All right, thanks so much, guys. We've got a few more resources just to share with you. Again, this PowerPoint will be sent to you, so you'll have these available to follow these links and do some more research. We've had, as Chris mentioned, a number of questions flow in throughout the presentation. We will have a follow-up to you on those questions, and we'll share with all of the participants. But thank you so much to Denise, Rich, and Chris for all your efforts to pull this together. We appreciate everybody working through the technical difficulties we had. So that was fun. But we hope everyone has a great day. Again, we'll have follow-up on your questions. Please don't hesitate to reach out if you have questions that you think through later today. And we appreciate you spending your Friday morning with us. We wish you all good health and safety, and we look forward to speaking with you soon. And more importantly, we look forward to seeing you soon in person sooner than later. So have a wonderful day. We're going to close down the meeting, and we look forward to talking to you again soon. Take care.